conversation that we'll be having. So for this October session, let me share my screen. We had our article that we were looking at was around zoonoses and and climate change, particularly considering that right now, like as you are aware, there's a there's an Mpox outbreak that's happening globally. And so we thought it would be, and we're just coming from the COVID-19 pandemic, which was global pandemic due to a zoonotic disease. And it's predicted that we are going to have more and more worse pandemics due to climate change. So we thought maybe it would be great to have a discussion around this and learn from insights and experiences from each and every person who has joined around that. So to kick us off, I'll just sort of give an overview of what the article covered for the sake of those who didn't get the chance to read, and also just for it's more like a general overview, just sort of to kickstart the conversation. So, zoonotic diseases or infections that can be transmitted naturally from vertebrate animals to humans, or from humans to vertebrate animals. And more than 60% of human pathogens are actually zoonotic in origin. I'll share some of the links where people can have like resources to read more. But I found it quite like interesting to think about how 60% of human pathogens are zoonotic in origin, and really thinking about climate change and biodiversity. That was quite mind-boggling for me. So some of the common diseases like bacterial diseases that we are aware of, like in clinical practice and in communities that are actually have a zoonotic that is zoonotic. We have anthrax, and we have Lyme disease, we have salmonellosis, we have tuberculosis, and if you and zoonotic disease is not really just about humans per se, but it's also like the interaction between humans and animals, and some of the infections can go in both directions. Then some of the viruses were rabies, Ebola, HIV, Mpox, the virus, which was recently recorded in Rwanda, where they are currently uh, addressing some of the cases. So this is some of the main this is that shows like the importance and relevance of having this conversation, and particularly in the context now where we are having a triple um, planetary crisis. Then some of the parasitic ones, the common ones that people talk about, malaria, toxoplasmosis, uh, giardiasis. I don't know how to pronounce that word very well, but yeah. So these are some of the parasitic. Then some of the fungi ones are ringworm, and this can even be transmitted like from human to like from pets, and considering like the proximity that's there. So some of the main factors that influence sort of zoonotic diseases are climate change, deforestation, loss of biodiversity, habitat alterations, movements of animals, urbanization, globalization, and a lot of these are actually interrelated. Like when you really think about climate change, you can't separate climate change from loss of biodiversity. You can't separate it from deforestation in terms of considering the role that trees make in also like some of the habitat alterations. And I think so, which is also a very important perspective when you're really thinking about health on a broader scale, when you're thinking about health, uh, One Health, planetary health, and the interplay of these issues. So these are issues. So the issues that also affect zoonotic diseases are also issues that are quite important in when you're really talking about climate change. And this is just sort of a reminder of like what climate change is in terms of the definition, which is the long-term shifts in temperatures. And and human activities has been the main drivers for climate change, which I think right now, which is why as humans now we really are at a phase where we urgently have to start thinking about our actions and how we can continue. So so in terms of the link between climate change and zoonotic diseases, it's noted that really continued global warming will really impact all zoonoses and also increase the emergence of novel infections with pandemic potential. So meaning that if we do not address like we don't if we do not meet our targets and we do not address global warming, and one of the main issues that we have to really one of the main dangers that we are going to face is then increasing in the pandemic potential, in having more pandemics, like even more serious pandemics in future. So you'd find that with the last Paris agreements, they talked about like limiting the temperature increase to 1.5 degrees Celsius above pre-industrial level. But in the last report from February 2023 to January 2024, we exceeded that average by uh, due because of the partly because of the El Nino. So you'd find that like breaching the limit on a monthly basis may not really cause a lot of alarms, but one of the key things that it indicates is it's actually an early sign that we are getting close to exceeding the long-term limits, because we're really concerned about when you're talking about climate, we're talking about long-term limits, which is also like an agent call for us to act uh, in terms of that. And that also means that we are not really looking at the impact of exiting the threshold on zoonosis. Because right now we're talking about Mpox, we were just talking about COVID-19 as a pandemic and the Marburg virus right now in in Rwanda and a lot more. So so really, if you look at it, it affects pretty much most of the like as we mentioned like earlier, that 60% of the of pathogens that cause disease in humans, more than 60% are actually zoonotic. So every aspect of climate change impacts like the different pathogens and the disease that they cause. So you notice that warming has an impact on vector-borne diseases. The same with precipitation and floods impact on waterborne diseases. Because when floods come up, you're really worried about cholera, you're worried about uh, typhoid and related. Then in terms of drought, it also affects some of the distribution of some of the animals. And another element that happens is some of the severe weather elements also affects the movements of animals and bring them closer to humans. Also encourage which pushes more direct contact amongst the humans and animals. Then also the loss of biodiversity again pushes animals towards humans in terms of spaces. So you'd find that a lot of not only increasing like human wildlife complex that is as a result of this, but you also find even like that close interaction also has a lot of risks associated with zoonotic diseases. So some of the predictions that have been done so far, considering that it's an area that like a lot of work still needs to be done as far as really projections, and is they've noted that there's been a 4% increase in the transmission of dengue fever uh, between the periods of 2021 to 2024 to 2021. And they've also noting like the increase in malaria's geographical range. So in some parts of Southern Europe, where they did not anticipate to have malaria in this day and area, there's risk of having some of the cases that is concerned. So it's not only malaria, leishmaniasis, there's a risk for the increased geographical range. Then also the same with the risk for schistosoma, which is expected to increase by 20% over the 20 to 50 years in East Africa. Um, yeah, we have the geographical range being affected of some of the animals because of the different climatic conditions. Then then we also have, like, in terms of the severity, also expected to be to increase with more pandemics. So the article has has some recommendations that we can start thinking about. And I think some of the work has also already started doing, like really thinking about having ecological knowledge being central to our policy decisions. So meaning that we are no longer moving away from viewing health in isolation, but integrating it into really integrating like the ecology in it. So I think already One Health and Planetary Health tries to do that. Then there's also recommendations around modeling. There's some universities that have already started doing some modeling to inform some of the disease hazards and to help in timely preparations. And I think which also means that for our institutions on the continent, we have to really start like strengthening our research capacity for us to also be able to do predictions for specific to us, then also strengthening disease surveillance in areas that are at risk. I think so, meaning that I think most countries really need to have like very strong risk analysis to look at how nationally what's going to be the impact, then also looking at sub-regions, like which regions do we have to play um prioritize based on some of the changes there and what risks are there and how do we strengthen disease surveillance. And I think disease surveillance is also important in terms of early identification of some of the dangerous zoonotic diseases, particularly when you're looking at Ebola, Marburg disease, which have significant high mortality rates. Then another really recommendation is having integrated approaches like One Health, where you're really looking into multi-sectorals coming in and you're not really thinking just about human health, but you're looking at human, animal, and environmental health. Then planetary health, which the Planetary Health Alliance defines as a solutions-oriented transdisciplinary field and social movement focus on analyzing and addressing the impacts of destabilize natural systems on human health and all life on Earth. So really, you're not thinking about broadly placing human health into the broader planetary health. So you're looking at biodiversity, you're looking at the environment, you're looking at um, the animals and everything that's in it. So yeah, so generally the paper really. So in this presentation, I actually went on to introduce some of the things that were not included in the paper, just sort of to help in context. But the focus of the paper really was really making a case that these are twin threats that we should be concerned about, and like as mentioned, like the interactions that happen between the two. So yeah, so that was like sort of an overview of the paper, and yeah, I'll open up the discussion to anyone to the rest of the platform. Thank you. So since we're in a small group, just feel free to unmute and share your thoughts about it. Can be specific to the paper or it can be broadly around the topic of zoonotic disease and climate change. Yeah, thank you.
Inashe, thank you very much for that presentation, the summary of the paper. Maybe just before we start, I've seen that some colleagues have joined. Just to let them know that we have French translation available, and if you wish to have the meeting in French, we used to do it systematically, But as we were a small group today, we have different sessions with a heterogeneous group because the topics are not the same and the interests are different. So as we are a smaller group today, we thought it would be a better idea as those who were here at the beginning were able to speak in English. But si vous parlez français et que vous avez envie d'avoir une interprétation en direct, n'hésitez pas, s'il vous plaît, à nous le faire savoir. Merci beaucoup. Thank you, Tinashe.
Yeah, thank you, Ashim. Yeah. So yeah, we open up the conversation. Any thoughts, reflections? And if you're already doing some work around that, it's also great for others to learn on the go in terms of some of the initiatives um, that you're doing, be it if you're working in One Health, you're working in planetary health, if you're working in infectious control, disease control, how you're integrating that and how you've thought of that. Also, yeah.
Maybe to sparkle the conversation, I've heard in the introduction that Juvenal is directly a practitioner at the intersection of climate change and zoonotic diseases. Maybe he wants to share his experience with us to start with. Juvenal?
Okay, yes, Hashim. Thank you, Hashim, for this. I don't know. As I said, that I'm working during the 3 last years on Lassa fever, which is zoonotic disease, as you know, in Benin. And from my experience, I can say that many people doesn't know that our behavior has impact in our health. For example, if I take example of Lassa fever, we know that many people contact this disease by their behavior. They go in forest, eat some rat and so on. So they contract this disease, and this disease is so lethal for them. And from my experience, I'm in fear about this disease because the lethality of this disease is up to 100%. If you get the disease, you are not more chance to survive. So I think we have to combine our effort to educate the population, to reach the population to adopt a good behavior to avoid this disease. In Benin, in the north part of Benin, around maybe up to 2% of people have this disease, and there's no. So maybe many deaths in this country is due to this disease, for example. So I think that we have to continue to sanitize, to educate our population about the consequences of our behavior, the consequences to don't have a good behavior, as I say that. So that's what I can say about to start with the discussion. Thank you, Ashim. I don't know if you have more question or more explanation you want. Thank you.
Thank you very much, Juvenal. I don't know if some other colleagues have question for you, but I'm curious about because I'm a medical doctor as well, and I'm not very familiar with zoonotic diseases in my daily practice. But as you mentioned, you have been working on Lassa fever for quite some years now, and you have shared your experience with us. In terms of disease surveillance, I'm curious to know what your experience is at country level. What do you think that the capacities that we have in our country, if we focus specifically on Lassa fever that you have been working on, do you think that the disease surveillance capacity that we have is enough to protect us, because we are part of the population, from the impact of those diseases? Thank you.
Thank you, Asim, for this question. Yes. In Benin, something was done about the surveillance about emerging zoonotic disease. As you know, in each department, there are some people who are working about how to detect earlier this disease. So we have a duration of Lassa fever and hemorrhagic fever. So when these people have some sign or some symptom in Benin, they can early start to identify a pupil, a contact pupil, and try to do their best. So in Benin, we have some point, I can say something is done, but we can do better. We can do better. We can do better because, for example, in Benin, until last years, we have only one laboratory who have capacity to diagnose this disease. And this laboratory is at Cotonou. But we know many of the diseases are taking place in the North part in Benin. So if I want to give some example, for example, if I have a case or suspicion case in North part, maybe it will take 24 hours before to get a result. So I think we can do better. We can do better. We can reinforce our capacity to detect earlier the cases. We can reinforce our capacity to sensitize a population about the disease. So I think something is done now in Benin, but we can do better regarding surveillance of disease and zoonoses. And just to complete that, many of zoonoses don't have a novel symptom. At the beginning, is that the symptom is similar to malaria. So it's very difficult for a normal practitioner to know if it's zoonotic disease or is malaria or and so on and so on. So in this case, we have also to develop and research some tools, maybe rapid diagnosis tests in this region to help a practitioner also to detect earlier the cases. Thank you, Ashim. I don't know if you get me.
Thank you very much.
Ashim?
That
Okay.
was useful.
Yeah.
Thank you very much. Yeah. Thank you for sharing this with us.
I think for me,
Thank you.
yeah, I think for me, what I found when I was reading the article and really when I started really thinking more about zoonotic diseases, because like Ashim, like as you mentioned, like as a medical doctor, sometimes when you're treating patients, you're not thinking of, okay, this could be. But for me, looking at how, for example, ringworms, um, and it's something that's a fungal disease that we treat, that we see constantly. But like if you see that people like that, people with pets, like it can be, it's something that we do not actively think about, which is why there's the importance of the One Health approach, where you're really thinking also about the 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 animals, the health of the animals involved. Because I think most of our focus has been human centric, where we're really thinking about human health, but not really thinking about the interaction of human health and the environment that we're in, the interaction of human health and biodiversity, and the interaction of human health and so often when we people talking about zoonotic disease, usually the emphasis would come up when when there's a pandemic, when the that has happened, and it also has some stigma that comes with it, because which again I think which shows the importance of really thinking through the need for more education around that. Like, remember when COVID-19 happened, or whenever there's an outbreak, people say, oh, it's because this group has a certain practice, like they, but sometimes you don't think about circumstances that that are resulting in, for example, in destruction of wildlife inhabitants that are pushing wildlife closer to humans. I worked in a region where at some point where in the northern part of Zimbabwe, where essentially there's a lot of wildlife and animal conflicts, and they were in constant contact with. But unfortunately, I tried to engage the wildlife department, but we didn't really work with them closely. I think, which is now, I guess, when reading through this and considering this conversation, these are some of the things that I would look back and I would do better if I were to sort of work again in that region in terms of really having the wildlife department and management like as one of the key stakeholders in terms of strategic planning and all. So those are some of the things that were coming in my mind when reading reading this article and reflecting on some of my like some of the lessons in my own experience like as a medical doctor.
Thank you very much. So I was reflecting on what you said, Tinashe, and I was lucky to be. I was in Rwanda 2 weeks ago. I spent a whole week there, and so I'm bringing the human behavior perspective here. When I went in Rwanda 2 weeks ago, everybody was um, so you remember the same atmosphere that we had at the onset of COVID-19, where everybody was anxious about what it is, and everybody was uh, following the rules in terms of hand washings and etc. It was the same atmosphere that I've seen in Rwanda. And wherever you enter, there is soap and people force you to wash your hands and etc. The security guards at any restaurant or at any market, they force you to wash your hands. So currently, I know that I have a friend of mine who should be there next week, but they have canceled their meeting because it seemed that the situation has worsened. But my perspective is when I compare what I've seen there to what I have in my country, in Benin currently, and in many other settings, we are less cautious about prevention when the risk is not there now. People are not washing their hands anymore. People are not taking precautions that they used to take when they know that the disease or the risk is there. And I'm taking this reflection at another level in terms of policy also, in terms of policy and public health in our countries in general. We are very reactive. We are mostly into reacting to what's there now, and not enough into prevention. Why did we forget about what we used to do and which was good practices, general, casual, good hygiene practices that we have acquired during COVID-19? For me, it was an opportunity for policymakers to maintain those standards of hygiene for everyone, so that we can use it to not only for diseases, but just, for people to prevent, not only for zoonoses or pandemics diseases, but for casual, regular diseases, hygiene related diseases that we can have in our daily lives. So that is a reflection that I wanted to share as well in this. And yeah, if you have any comment or reflection about the human part in all this, the human part in terms of reaction and response to the diseases, and how we should do about prevention mainly.
Hi everyone, if I can just chime in, I think all of the points brought up so far have definitely gotten me thinking. In terms of reaching the communities, and I'm thinking about how at International Medical Corps we're currently in the process of building different trainings around climate and health. First for community health workers and then also for clinicians. But I'm just wondering if anybody has any experience in this type of training and if there's any key messages that have seemed to really stick with the trainees, or any type of messaging components that have seemed to really work for this type of information. I would love to hear everybody's thoughts or even suggestions on how a training on zoonotic diseases could be strengthened for health workers.
So I can go, Rachel. On zoonosis, I don't know if there is something specific about it, but there are a few initiatives as far as education climate education is concerned. I am sure you have heard about the Columbia University and the Consortium of University on Climate Education, the European, Asian, African Climate and Health Responder. There is something like that going on. I've followed the European. The African is currently going on, and I think that the Asian has been done also before. So that is one education. I know that the Planetary Health Alliance as well have put together a list of curriculum on climate change and health worldwide that I can share as well. But specifically on zoonotic, I don't know if other colleagues know about an education. And what we are doing also here in this journal club is a way to maintain continuous education on climate and health in Africa specifically, so that people get to know better and better about it. Over for now. I don't know if other colleagues have, but maybe Rachel as well, maybe if you want to share with us what you do at International Medical Corps in general, and in particular on zoonosis. Thank you.
Thank you so much. No, that's very
So good
useful.
evening.
And oh, please.
So thank you. My name is Jean Damo. As you can see, I'm from Rwanda, and I apologize I joined late. From that question you just asked, I think we do not have the formal trainings as such, but some networks, I think there are some. I have seen there is this African One Health University network, if I remember well. It does coordinate some trainings with the One Health clubs in different universities and different medical communities. So, but for those particular zoonotic diseases trainings, I didn't get any such training, but I had some just introduction in courses during my medical school about One Health and just as in general, not just specific. Thank you.
Yeah, thank you both so much. And I think I share in it's great to hear that you had received some training in your medical education. I know I hear a little bit differently from from different people about how much information that they're receiving on climate change. But just quickly, in case it's of interest to anybody, IMC, or International Medical Corps, is a first responder organization. So we are responding to humanitarian crises throughout the world, but specifically on climate change, we're really ramping up our programming quite quickly. And our approach is centered around 4 main pillars of action. So first, we put an emphasis on building capacity on the impacts of climate change at the global level and in all the countries where we work. Secondly, we want to strengthen the emergency response capacity. So it goes along with disease surveillance and all of that type of information that we've been talking about. Third, we want to strengthen health systems. So that is where our training comes in. And then fourthly, we have an emphasis on reaching communities and making sure that they have the resources and information available to mitigate and adapt. So thank you. I've written down all of your suggestions, and if anybody has questions about what International Medical Corps is doing, I'm happy to provide more information.
Yeah. So I think this conversation sort of reminded me about a message that I received yesterday with one of our colleagues asking me if I have copies of any specific protocols that are to do with health. I think at policy level, there are few countries. I know Uganda is one of the few countries on the continent that have come up with a policy that's specific to health. I'm not sure if Kenya and a few others, but most countries they integrate it as a cross-cutting theme, but they haven't come up with very specific health-oriented, like health-specific policy, which I think also then delays in the health sector, like treating it as an urgent issue, but like as an issue that needs to be prioritized. Or sometimes I think it also means lack of guidance around on the ground. What does it look like? What are the priorities in the health sector we have to come up with, and how best can we move forward from that? So I think it's great that the conversations are starting, and I've seen in terms of approaches around education. I think most of the education has been around CME events, though the Global Consortium is really pushing for partnerships with educational institutions so that they can really look into integration of climate and health in the medical education curriculum. But it's something that I think right now they're currently doing a study to see the extent of integration, which I think would be also helpful in terms of really looking at which countries, particularly on the continent, have already integrated and which ones are yet to integrate. But there's some networks like I think it's called African Community of Planet. I'm forgetting them. They've done some work in Kenya where they try to work with they try to incorporate indigenous knowledge systems into bringing in the conversations around the environmental conservation broadly, the importance of that. Then they start bringing in the issue of climate from the perspective of the environment, from where people understand the environment. Then they bring in they build on other concepts. I think that's quite useful to sort of have an approach that sort of gets an awareness of where people are at as far as the discussions are concerned. What are they understanding? Then start building on that. Yeah, that's also relevant to the context. And I think then try to also not only educate them, but do it in an approach that is participatory so that they can be partners for change within their communities, and they can be partners for change and spread the message to others. And if it can be done in a language that they fully appreciate and understand, even better, because I've noticed that sometimes as health professionals, there's certain language that's great in spaces that's technical, but when you're not at community level, like particularly most of our colleagues who work right in the community, they'll tell you that, well, in my community, we don't want such big words. We want simple language, straightforward language. How do we break down climate change in my language to the communities that we're working with? How do we break down all those jargons? How do we make sure that people understand zoonotic diseases in terms of, because like as much as we just had an introductory to it, even in medical school, for a while, I never really thought like some of the interactions in my finger breaks. I would not think about what could be zoonotic disease or that zoonotic connection to some of the common diseases that are there. So when you're seeing diseases that are that are now sort of listed under zoonotic disease, sometimes I'm surprised. So it's just, so it also shows that it will not be a completely new concept, but it's only that missing, there's something missing in the communication, in the understanding of it. And those missing pieces can also help in having a comprehensive conversation around, so that people also realize that it's not something, they're not learning something completely new, but it's something that's adding to existing knowledge. It's something that's helping them understand better diseases in their communities that are affecting. It's something that's helping them uh, broadly in terms of planning, when you're really thinking about the need for resilient health systems, when you're thinking about what has been discussed earlier with everyone, like the needs for, like Ashim talked about, where you're not thinking about being proactive, where you don't have to wait to start washing hands and having that behavior when there's a pandemic, but you're actually proactive in terms of integrating all of this, in developing a culture where people wash their hands, and in the process they prevent so many diseases. Then you're also thinking about infrastructure that allows people to be able to practice those hygiene that's there. And you're also really thinking about broadly in terms of how can you, when you're thinking of health systems, resilient health systems, how do you incorporate surveillance, not just like improve surveillance when there's a pandemic, but it actually becomes part of order. Then how do you bring in multi-sectoral approaches, multi-sectoral approach? How do we have like the veterinary scientists in the room, the people who are working with animals, how do we have them in the room in the conversation around? Because even when you're talking about antimicrobial resistance, I know a lot of the conversations are connected, but they're happening in silos. I think that's what I'm finding a lot in the community space. So I think in the education, those connections are also important to sort of build into already what's happening, showing people those connections that, okay, you can't, antimicrobial resistance, One Health, we're talking about zoonotic diseases, then really talking about, when you're talking about infectious diseases and disease control, most of the infectious diseases that you're really talking about actually have a zoonotic link. So I think making those connections is also very, very important. So we have about 6 minutes left. Yeah. So feel free, if you have, feel free to unmute for a small group. Feel free to unmute, share your thoughts and comments, and yeah.
So we have a lot of colleagues that have joined us. Maybe they want to introduce themselves and share what their interest on the topic is, and if they have anything else to share with us. It could be a good use of the remaining time.
Hello to everyone. So my name is Ayuk, and can you hear me?
Clearly, yeah.
Okay, great, okay. So my name is Ayuk, and I'm a PhD student in sociology. I've been doing some research in the area of sociology of health, and recently I got interested in looking at climate change and health, particularly neglected tropical diseases. So I found the webinar interesting, and so I thought I could attend and then get some insights from it. Sorry, I joined late because I was actually doing some other stuff, and then I had to just stop and join the meeting.
It's okay. Thank you very much for using your busy PhD time to join us here.
Okay.
Arya Gunawan, sorry if I mispronounce.
Good afternoon. Are you able to get me?
Yes, please go ahead, sir.
Okay, I'm Ian Sain. I'm working with University of Agriculture and Natural Resources in Malawi. My area of interest is mainly on sustainable agriculture, and this time around, I'm trying to find the nexus between climate change and health itself. Just because in sustainable agriculture, we concentrate on having safe food and the like, so that we can maintain the good health of the people at the same time looking at the production of the crops itself. And that's why I'm interested to be part of this. Thank you.
Thank you very much. Welcome, Ian. We hope that you stay with us for the next sessions, and also please feel free to suggest topics for our next sessions. Next will be Ange Marie Esse.
Yeah, I'm Ange Marie Nicodème Esse. I'm from Benin. I'm a health promotion specialist and community health advocate. I'm glad to be here to share or to hear the medical doctor who talk about this approach. That is a one health approach, I think, like zoonosis disease and climate change issues. Thank you for sharing. We are together. Thank you.
Thank you very much. So I'm really impressed because this is also an English class for many of us, and we are doing so well. So congratulations. Bonita McDonald, welcome. Please, can you introduce yourself, please? And next will be Evaristo. Bonita, are you able to hear us? Otherwise, Evaristo,
Yes,
you
good
can.
afternoon.
Okay, good. Perfect. Yeah, please go ahead.
Sorry. Okay, so my name is Bonita McDonald, and I'm a food inspector with the Guyana Food Safety Authority, Ministry of Agriculture. So I'm honored to be here today. Sorry that I joined late, but at least I was able to hear part of the presentation.
Thank you. Welcome.
Thank you.
Yeah. So you are from Guyana?
Yes, I'm from Guyana.
Guyana. Okay. Sorry for the mispronunciation.
Thank you.
Thank you. Evaristo, are you able to speak?
Yes, thank you. Good evening and good afternoon. I am Evaristo Maroa. I am from Zimbabwe and work in Harare as a dermatologist, and I also do some venereology. My interest is really to get exposed to information on the topic under discussion. And obviously, as a dermatologist, one will see some skin manifestations of some of these conditions.
Yeah.
So that's basically why I'm interested in this topic. And thank you very much for organizing it. And I hope to join similar conversations in the future. Thank you.
Thank you very much, Evaristo. So I'm even thinking that we could have a session on climate change and dermatology, something like that. I don't know how to frame it, but that's what I have in mind now. And it will be great to have you as a frontline actor on that session. Just thinking out loud. Thank you very much. Next will be Gloria Akoaku. You can go in French or English, and feel free. So, Gloria, are you able to? Yeah, she is able.
Je dirais en français mes excuses. Je suis Gloria Akoaku, je viens du Bénin et je suis étudiant au master environnement, santé, développement durable. Merci.
Bienvenue parmi nous. Nous avons normalement une session, une interprétation simultanée. Nous ne l'avons pas mis aujourd'hui parce que nous étions un petit groupe et au début, on n'avait que des personnes qui étaient d'accord pour aller seulement en anglais.
D'accord, c'est pas grave. Je vous suis quand même.
Good, thank you.
Merci.
So welcome, Gloria. Gloria is a student in development and I forgot, sorry.
Environnement, santé, développement durable.
Okay, so environment, health, and sustainable development. She's a student, master student. And I was just telling her that we used to have concurrent interpretation and we didn't do it today because the group that was there at the beginnings was comfortable in English. Next, God knows, I think you have already talked, but maybe if you want to introduce yourself again to the group. And after you, Jean Damou. I'm cautious of the time as well. So is Jean Damou there? Good.
So good evening. My name is Jean Damour Nyanguru. I am a medical doctor here in Rwanda. I'm working in the primary healthcare settings. So my interest is in climate and health, and mostly in primary healthcare. So as I have some experience, like last time I was, I think it's a week ago, I was just delivering a session on the impact of climate change on health. The young people that we are working on climate change project, and I was like, how do I prepare a presentation that is really feasible and in the context of non-English speakers? I mean, Kinyarwanda speakers, only the local language, and it was really hard. So from our discussions, we can also try to translate, I mean, the content and also in our context, I mean, our local languages. So it's my pleasure to be with you, and I'll be happy to join the following sessions, especially if there are some research opportunities in the area of climate and health. I'll be glad to grab them. Thank you very much.
Thank you very much. So we have monthly sessions. So we'll have another one in November, and we are happy to actually that's the aim of a club. It's very horizontal, and we'll be glad if you can take on roles and come and introduce topics and play roles in moderating the sessions and etc. So you are very welcome. Last but not least, Tobias Wangila. Are you able to talk, Tobias? Tinashe? I think everyone was able to introduce himself. I will hand over the floor to you.
Yeah, that's okay. Thank you. Thank you so much, Shim. And like, I just want to emphasize what Hashim mentioned earlier. Like, the vision behind this is for us to learn from each other and to exchange topics. And I think through that uh, we'll also find new opportunities, research priorities, and so yeah. And thank you everyone for coming through. In terms of, feel free to reach out to myself or Ashim or anyone if you have a topic that you would like to discuss, or maybe just before we close, is there anyone who has a topic that, two questions, is anyone attending the Climate and Health Conference in Zimbabwe? Then the second question is there anyone who has a topic that they would want us to discuss in the next session? Maybe just a minute for if anyone could respond to those questions.
Hello, good afternoon again. As I said, I'm sorry that I missed most of the session, but I don't know if the One Health approach was discussed in regards to climate change and food security. I don't know if anything was mentioned on that in that area.
Yeah, thank you. We have sort of mentioned it in we have mentioned it somewhat, like in terms of the importance of the One Health framework in responding to zoonoses and climate change. But I think if everyone agrees, we can actually have it as a specific topic that we can discuss in the next session. So would you be interested in leading that, or do you have any article that you would recommend for people to read? It's something that we can coordinate even like offline after the session, so that if everyone is agreeable to that, it can be our focus for our next session.
I don't have any article, but I can try and lead out in that session a bit. I can probably do a presentation or so in that regards.
All right, that's okay. Thank you. What do everyone else think? So far, I think the two topics that have come up, One Health, then also dermatology and climate change. So what do people think for the next session?
I think they're excellent topics, considering that now we're seeing more of dermatology cases, especially in primary health, and it's something that needs to be explored on the relationship between climate health and dermatology. I think it's those are good topics to cover.
Yeah. So it looks like we have two topics for the next two sessions. So what do everyone think that we do for the next session? We do yeah, I think we can. Yeah, I think we can. For the next session, maybe we do dermatology and climate change, sort of building onto those zoonotic disease conversations, and also integrates the infectious disease topic. Then afterwards, then the third session would also give like Bonita more time. Would then look at the session afterwards. That would be likely December or January, depending on what people feel like we in November. We can then look at what health approach to food systems. Bonita, what do you think about that such a proposal? And everyone else, what do you think about such a proposal?
Yes, that is okay with me.
Awesome.
That is.
Can I?
It's a good
Yes,
plan.
Dr. Bara.
Yeah, can I make a suggestion? It's
Yes.
for me, it will be difficult to lead the session or to contribute significantly to the session because I'm almost like a retired person with a number of few other things. So I can be part of the discussion, but not to lead. I can be part of the audience and so on. But I can't lead the dermatology manifestation, of climate change or association of climate change and dermatology. So.
Yeah, that's still okay. I think we can always really think about you can always recommend articles, or we can also look at articles that we can share to everyone, and also have this relaxed setup where everyone will contribute their own thoughts and their own like reflections from different sectors, because it's not only like, as you see in the space, we have it's multidisciplinary, which is great, and I think which is quite the important part of it. So yeah. So I think for now, I think what we can say is for the next sessions we're having these two topics. So I'm looking at the time. So in the interest of time, I think we'll reach out to you in terms of which topic we're having in November and which topic we'll be having in December based on the two suggested topics. But yeah, thank you so much for everyone for coming and for your time, and for staying longer. That's good. So we'll reach out to you in terms of, because we have your emails from the registration, so we'll reach out to you around more information. We also have a Google group, so if you're interested in added into that Google group, where it can also be, we also post the suggest topics on that, then we continue the conversation. All right, thank you everyone. Have a lovely day.
Oh, thank you so much. Good night.
Thank you, everyone. Bye.
Thanks, everyone.
Au revoir. Bye-bye.
Okay, bye.
Au revoir.